MACE Practice Test 2026 Military Acute Concussion Evaluation Exam Questions and Prep. Question 1. What is the primary purpose of the MACE-2 evaluation? To diagnose long-term PTSD. To evaluate a person in whom a concussion is suspected. To replace a full neurological exam. To screen for spinal cord injuries. The MACE-2 is used to confirm the diagnosis and assess the current clinical status of a suspected concussion. Question 2. Which of the following is a cognitive assessment component of the MACE-2? Grip strength, orientation, pupillary response, blood pressure. The orientation section asks about month, date, day of week, year, and time. Question 3. In the MACE-2, what does the term AOC stand for? Acute ocular condition, alteration of consciousness, advanced observation criteria, assessment of coordination. AOC refers to temporary confusion or having your bell rung following an injury. Question 4. What is the first step in the MACE-2 assessment process? Neurological screening, symptom checklist, description of incident, cognitive exam. Recording the event as described by the member or witness is the initial step. Question 5. Which observable sign after head trauma suggests a possible concussion? Normal balance, clear speech, blank or vacant look, rapid response to questions. A blank or vacant look is a visual clue suggesting a concussion. Question 6. What is the maximum score for the orientation section of the MACE-2? 5, 10, 15, 20. Orientation is scored out of 5, month, date, day, year, and time. Question 7. Which test is used to assess balance in the MACE-2? Finger to nose, pronator drift, BES, modified balance error scoring system, grip strength. The MACE-2 uses a modified BES to assess balance. Question 8. During the MACE-2, immediate memory is tested by asking the patient to repeat how many words? 3, 5, 10, 15. The memory section typically involves repeating a list of 5 words over 3 trials. Question 9. What does a negative score on the orientation section, less than 5, indicate? A confirmed concussion, normal cognitive function, potential cognitive impairment, a spinal injury. A low orientation score is a clinical indicator of potential concussion and impairment. Question 10. Which symptom is most commonly reported after a concussion in the MACE checklist? Hearing loss, headache, abdominal pain, rash. Headache is the most frequently reported symptom following a concussion. Question 11. Delayed recall is tested after how many minutes in the MACE-2? 1 minute, 2 minutes, 5 to 10 minutes, 30 minutes. Delayed recall of the word list is assessed after a delay, typically 5 to 10 minutes. Question 12. Which of these is considered a red flag requiring immediate evacuation during MACE screening? Mild headache, drowsiness, seizures, slight dizziness. Seizures, worsening headaches, and repeated vomiting are red flags for severe injury. Question 13. In the MACE-2, the neurological screening includes which of the following? Speech fluency, grip strength, pupillary response, all of the above. Neurological screening covers speech, eyes, grip strength, and pronator drift. Question 14. If a service member loses consciousness, lock, for 2 minutes, the TBI is generally classified as severe, moderate, mild, critical. Lock less than 30 minutes is typically classified as a mild TBI. Question 15. What is the SAC in MACE derived from? Standardized Assessment of Concussion. Symptom Assessment Criteria. Screening for acute concussion. State of awareness check. The examination section is derived from the Standardized Assessment of Concussion, SAC. Question 16. Which question is part of the orientation assessment? What is your name? What is the date today? Where are you? Who is the president? Specific questions include month, date, day, year, and time. Question 17. The MACE-2 symptom checklist asks the patient to rate symptoms since birth, the last year, the injury event, the last week. It assesses symptoms experienced since the specific injury event. Question 18. Which of these is not a motor test in the MACE-2? Grip strength, pronator drift, finger to nose, rapid eye movement. Grip strength and pronator drift are motor components, while eye tests are sensory/motor, but rapid eye movement is not a specific MACE test name. Question 19. How is the immediate memory trial performed? The patient writes the words. The examiner says words and the patient repeats them. The patient reads words from a card. The patient identifies pictures. The examiner reads a list and the patient repeats as many as they can. Question 20. What should be done if red flags are identified during the MACE-2? Continue the assessment. Ask the patient to rest for an hour. Immediate medical evacuation. Repeat the orientation test. Red flags indicate a potentially life-threatening emergency and require immediate evacuation.